Hi, this is the prep for class number 1, and it's going to be on dysrhythmias. And just a little bit about the classes that I do. I just want to let you know that there is a prep for most classes, and it will be, all the information will be in Blackboard under course content, and there will be a specific folder for the concept. And for example, the concept is circulation perfusion, and we're going to be talking about dysrhythmias for the first class. So make sure that you go in and take a look. Review the outcomes handout that you usually have and the class prep. In this case, it is a short YouTube and a couple, I've posted a con video and another 5-minute video about EKGs. View any assigned YouTubes, etc. And if you would, please bring your text to all classes. I refer to the book a lot during the class, so you'd be better off having it. And all this is all about is you're going to be coming to class ready to discuss the topics in more depth. We won't be spending as much time on A&P. We'll be actually beginning to talk about the concepts themselves, such as dysrhythmias. And without further ado, let's go ahead and start with care of patients with dysrhythmias. What the learning outcome for this exemplar would be, you're going to be learning the different various dysrhythmias and their treatments, and we will be creating a concept care map for them in class. And so dysrhythmia, what is it? It's just a variation in normal rhythm. You already know about the normal and regular and irregular and that sort of thing. An abnormal rhythm results from impulse formation disturbance or a conduction disturbance. And I know you've had this before, but I am going to review it just a little bit. These are some words I just want to make sure that you understand because we will be referring to them, and I'm not going to be going over the actual definitions of these because you should know them, okay? And when we talk about the cardiac rhythm, what we talk about is it's an electrical wave, and it's like a wave at a football game. As you can see here, it starts at one side and it goes right to the other side, and there is a rhythm to it. And you can take that and apply it to this heart here, and you can see that the impulse starts in the SA node, travels down, and ends up in the ventricles. So for this, I want you to understand depolarization and repolarization. You've had this before, and there are specialized myocardial cells in the heart that are nowhere else in the body that are able to carry on this electrical activity. And you can see that these cells have an automaticity, their excitability, they have conductivity and contractility, all that in those cells only. And for more information, I've embedded a cardiac cycle here that you can take a peek at if you'd like. Now, the natural pacemaker of the heart is the SA node, as you know, and that's the primary pacemaker, aka it's a sinoatrial node. What I would like you to take away from this is that the primary pacemaker has a rate of about 60 to 100 beats per minute. Excuse me, the impulse then travels to the AV junction, which is called the gatekeeper, and this is a secondary pacer with a rate of 40 to 60. So if your SA node fails, your AV junction takes over, and you can live with a rate of 40 to 60. Now, if the AV node fails, you have a ventricular rate, and that's 20 to 40, and you're in trouble here. But that's called a tertiary pacer. So those are the three natural pacemakers that we have in our hearts. Now, is it EKG or is it ECG? It really doesn't matter. Trivia for today, EKG, it came from the German electrocardiogram with a K. Call it ECG, EKG, doesn't matter. So I would like you to know what it is, how it works, its purpose, indications, and any type of patient information. We will go over interpretation. telemetry is something that is commonly used to monitor cardiac status in patients that have cardiac issues. It is a flat, one-dimensional view of the heart, okay? And I have also posted an ECG placement YouTube. It's 5 minutes, and so you can actually go over that and see what it is and how they do it. The 3-lead EKG is a short, quick telemetry monitor. If you want to do a truly diagnostic ECG, you're going to do a 12-lead. And the picture that I have here shows you the actual leads up at the top where you can see my pointer is. But if you come down here to the larger picture, you've got the heart here, and then you have the arrows. And these arrows are what the picture, the ECG picture is making. It's the waveform. And if you look, the waveform goes in all different leads. So this one is the 12 lead is a 3-dimensional view of the heart. And you can actually look at the heart and see where, if there are any issues, if there's, say, for example, an MI where they've had cardiac cell death, it's going to show it in the 12 lead. So I just wanted you to know what the 12 lead was all about. So when I was talking about it's going to show it and that sort of thing, what I'm talking about is the ECG complex. And I want you to think of it like a road map. And it shows the road that the impulse travels, okay? As it's like the road travels through a map. It's gonna go in a particular way, and this waveform indicates the location of the electrical impulse as it travels through the heart. And I have under here normally, and that's the thing, we have to normally know what's the road that's usually traveled, what's the electrical activity that's usually traveled. Then we can look at the deviations, and those deviations are dysrhythmias. So I have posted a video. It's called the EKG or ECG, simple. Now this is a 27-minute video, but it is the best, most straightforward understanding explanation that I have found on ECGs, and I think it really will speak to you. So please watch that before you come to class. It is excellent. So therefore, once you get through this and the prep, you're going to come to class with some basic knowledge. You're going to know what an ECG is and how it's done, what the waveform is, what it represents, how to interpret a simple ECG strip. You're going to get this from the video, and determine heart rates. And I put this note down here. Please don't worry. You do need to come to class with this basic knowledge. We will be discussing this in class with NCLEX style questions. And the whole idea is that we're going to be able to spend more time on the dysrhythmias rather than the basic information, because you'll already have that. And that's the whole goal of the class. So when it comes to class, what we're going to be doing is we're going to actually analyze rhythm strips. We'll be discussing risks, age considerations, that sort of thing. We'll be going over diagnostic treatments, pharmacology. We're going to be creating care maps, and we'll be, of course, doing the practice questions. So reminder, always bring your book to class, and if any questions, as always, come see me or shoot me an email. Thank you. See you in class.